Well, in our health check tonight, coronavirus isn't the only thing we need to protect ourselves from right now. There's also the cold and the flu. And as COVID-19 cases and deaths are on the rise, is now the time to isolate. In tonight's health check, KSNT News reporter Lindley Lund spoke with one local healthcare professional to get answers to that question.
Dr. Kennen Thompson is the medical director of the emergency department at the St. Francis Hospital in Topeka. Recently, he says he's been seeing people not taking the simple steps to prevent colds, the flu, and coronavirus.
Covering your nose and your mouth, turning away from individuals with sneezes, and remembering to wash your hands and avoid touching your nose, your mouth, your eyes.
However, with the Shawnee County Health Department seeing coronavirus cases spike by more than 100 in a matter of days, Thompson says we need to take extra steps to stay safe. But does that mean completely isolating yourself, similar to what we did in March? Thompson says not quite.
It's okay to get out, to participate in business. You know, everyone is trying to work together to get through this, but everyone has to do their part to try and, protect themselves and to protect other people.
So you can still go to the grocery store or restaurants, but make sure to wear a mask, distance yourself from others, and still do these common things you would to prevent the cold or flu, and now coronavirus too.
Be aware that the virus can be in the air, it can be on surfaces. Really, it's a question of vigilance right now, of making sure we're trying to keep yourself protected from any type of exposure that we can minimize.
If you do experience any symptoms of coronavirus, fever, body aches, chills, cough, or shortness of breath, that's when Thompson recommends staying home, as well as avoiding others and waiting a few days before getting tested.
It may take several days for our test to even be able to detect it.
If these symptoms worsen or last 5 to 7 days, Thompson recommends seeing a doctor. For tonight's health check, I'm Lindley Lund.